Hi there, my name is Dr. Louise Crowley. I oversee the Clinical and Communication Skills Programme at the University of Limerick. I just want to give you a brief overview of the programme. The medical school here uses a problem-based learning approach, or PBL approach, so each week the students get a different patient problem to solve or work through, and they do this in small groups of 8 or 9 students. And likewise for clinical skills teaching, the skills are taught in the same PBL groupings and in the context of the clinical case. So we draw on the principles of adult learning in that whatever problem you're learning about, you learn the skills in our classes to help you deal or solve the problem. So for example, if a patient presents with chest pain, in your PBL case, you will learn how to talk to the patient about the chest pain, how to take a relevant history of that chest pain. You'll get to perform an ECG, and you'll also learn how to examine the patient's heart or circulation system. So learning in context is very important. So what kind of skills do we learn? Well, we learn how to take histories or gather information. We learn how to give information to patients in an understandable way. We learn how to examine the patients, perform physical examinations, and we learn some procedural skills. Okay, so the methods we would use for gathering information or giving information involves the tutor getting the group to brainstorm on the approach you would take and the information you would need to find out, and then students get to practice in role plays with each other, and they also can look at videos. And in the second year of the programme, we bring in a lot of simulated patients or pretend patients, and ultimately towards the end of the year we have some real patients that come in as well. For physical examinations, we rely heavily on peer examinations, so that involves the students examining each other. And for most students, that's not a problem. They'll come in their sports bras, in their sports gear, and they're ready to kit off. But for some students, that may cause a problem. For example, if they have part of the body that they're self-conscious about due to a scar or a medical problem. And we've no problems with that as long as students just inform the tutor beforehand, and they might volunteer for some other skill. So we're very lucky that we have a range of technology, simulators, simulated patients, a hugely dedicated group of tutors. But I suppose the most important tools from a student's perspective are that they would use their eyes, their ears, fine-tune their physical examination skills so that they can rely on themselves when they're interacting with patients in years 3 and year 4 in their clinical placements and further on in their medical career. And I suppose what we try to do in years 1 and 2 is, I suppose, provide a springboard and a foundation for students so that they can learn these skills in a safe environment and hopefully in an enjoyable environment, and that when they get into years 3 and year 4 they can build on those skills and consolidate them by having the opportunity to examine real patients under the supervision of their GP tutors in general practice placements, and in the hospital setting, obviously under the supervision of our consultant colleagues. A very positive part of our job as tutors and teachers is seeing students start off at the start of the programme being uncertain of what they're doing, and obviously learning from their mistakes, and seeing that progression from being a rookie, a very nervous individual, progressing through the stages of becoming an expert. And it's always very moving to see the students graduate and walking across the stage on graduation day, receiving their parchment and seeing the pride in their parents' eyes and the sense of achievement for the students. And also it gives us great pride to see them moving on and starting a new chapter in their lives, hopefully looking after our patients in the local area and throughout the world.